Get into the papers now, see what the headlines are across Nigeria. And I have with me the CEO of CKN News, Chris K. Good morning, Chris. Nice to see you.
Thank God it's Friday.
Thank God it's Friday.
We can still say that.
A cautious Friday. All right. Now let's begin with the News Direct newspaper now. Buhari approves 15 billion naira for Lagos, other states. NCDC to fight against coronavirus. And federal government traces 4,370 people. Abakari not secretly flown abroad, and aid is revealing this. Osun State closes land borders and others. Okay, that's what you see on the News Direct. Now, Blueprint is next as COVID-19 cases rises to 51. Okay, that has risen now beyond there. A lockdown imminent. Federal government declares. Lockdown is imminent. The federal government is declaring that now, and says 4,370 cases gave wrong data. All right, Buhari, hail and hearty. And to stop interstate travels, Baseki, Keredolu, Diri, Lai, others are negative as their tests come in. Lawan, TUC seek relief for citizen. You find all that on the front page of Blueprint newspaper. NCDC confirms, all right, Daily Times is next now. NCDC confirms 65 cases of COVID-19 in Nigeria. Says 12 new cases confirmed in Lagos, 2 in the FCT. Federal government urges Nigerians to maintain social distancing, and contact tracing of 4,370 persons in progress. That's the Minister of Information saying that coronavirus may be transmitted sexually. Health Minister is saying this, all right? So social distancing in every respect of it, all right? From Daily Times, let's go to Leadership newspaper. Nigerian billionaires team up against coronavirus. Dangote, Rabiu, Elumelu, Ovia, others donated 1 billion naira each to tackle pandemic. UBA doles out 5 billion naira. G20 offers $5 trillion to combat scourge. Federal government bans interstate intertown movement ahead of lockdown and traces 4,370 contacts with infected persons. All right, from the Leadership, let's go to Daily Trust now. Daily Trust is the last paper we're looking at right now. COVID-19. Federal government still searches for 4,370 contacts. Says time is running out to check spread, and government acted slowly. There's some opinions there. And Buhari's aide, Bala's friend, tests positive. Confirmed cases hit 65. Okay, that's what we see here right now. All right, Chris, some of the headlines we have seen there is saying that a lockdown might be coming ahead. In fact, we see that on the front page of the Blueprint newspaper. It has it, and then one other paper also has that. What scenario do you see? Because a lot of we've spoken to some persons who said that, well, let's take it as it comes. But others are saying this is a problem, that this is the challenge that kept us here where we are in the first place. If they had lockdown, or if these measures have been taken ahead before, we would have been able to mitigate this to a great extent. What do you say?
Yes, I tend to agree with the second opinion. The problem, that was the problem some of the European countries have or had. Italy, for one, didn't do the needful, and that is why you've seen the death toll has really risen to about, I think, close to about 8,000 now. Spain has overtaken China in terms of numbers. In the U.S., as of yesterday, it was 1,050, and it has risen.
U.S. is now the country with the highest.
With the highest.
Number.
The U.S. is the country with the highest, and especially New York, and where the number of cases is about 10 times more than other states. And you could see Governor Kumo crying himself out every day. And so they started late, because when the U.S. ought to have shut down, the president of the U.S. was saying, oh, we can handle this, we can do that, and the rest of them. And so I think ours hasn't got to that level. But if we don't do something drastic now, it will definitely happen. Some of us are of the opinion that immediately we had the first index case, we ought to have shut down completely. And with recent revelation coming in, how some people went to party in London, I came back with this, and some other. Now look at the one that just happened yesterday, just last night. 6 people in a vessel. Yeah. So while we shut down our airport, we probably left our seaport open. And probably some people have also been sneaking in through the borders and the rest of them. So it's a big challenge. And to some of our people who believe that coronavirus is a big man disease, as they have been thinking, it is no big man, it's everybody's disease and anybody could be affected. So, but I think it is time for us to shut down. And I like what some states are already doing.
All right. But some persons have also said that this will be a wake-up call when it comes to the investment in our health system all the while. Over the years, over the decades, we've not had much of that. And this will be a wake-up call now to the realities of what needs to be done by government at all levels.
Yes, that's a good point. Let's start from the seat of power. From information coming in here and then the rest of them, how one of the top government officials who has been declared positive, there have been insinuations that they're going to be moved and the rest of them. If we have had a functioning a clinic, I think that the First Lady some time ago cried out.
Raised an alarm.
Raised serious alarm. Some months back, and some people were saying, oh no, the woman is an alarm. If they had a functional hospital or clinic in Aso Rock, I don't think we'll be talking about this now. The same thing with the state, it's a wake-up call. The governors now, in fact, there was a hashtag going around social media some days back that all the government, all politicians, whoever contract that should be sent to his local government or to his constituency so that he'll be treated there, okay? With that, it is that now nobody knew, most of them didn't know, especially. If it wasn't for the lockdown, any of the top positions that has it would just fly out and either go to US.
But there's nowhere to run.
We are going nowhere now. There's
nowhere to go.
Nobody, we stay here. And so it reminds me of what happened after the coup of 1983, where most of our politicians were arrested and sent to Ikoyi prison, Ikoyi and Kirikiri prison. It was when they got there, they realized that, for goodness, oh, this is what is happening. If they had known that they would be sent to that place, at least they would have made effort to make sure that the place were, if you understand what I'm trying to say. So, my people have a saying that when rain, they beat slave. You go still beat the person with your gun. Because you cannot leave your slave and just say you want to go and take shelter somewhere. So both of you...
This comes to all humanity.
It does.
And that's why across the world there's panic. Now let's bring it back home to the issue of panic buying and all of that. We've seen and heard reports of people panic buying, stocking up on all sorts of things, and also hiking the prices of things.
Well, that's man's inhumanity to man. That is in our nature, is in our culture. But especially those in Lagos should also not forget that, yes, markets were shut down, but food markets were not shut down. So people can still go to market and shop. Pharmaceutical pharmacies were not shut down as well. But
hospitals are not shut down. Banks are still working.
I went down around yesterday as a journalist, especially within the Lagos area, and I realized that there are some high level of compliance, although some people still flood that order. But most of the shops were shut down. So panic buying is expected. But don't forget that most of our people live on a daily basis. Most of them cannot afford not to stay home.
Exactly.
Which is where I am looking at. I've seen a lot of donation coming in and rest of them. Some of these donations should also be used to cushion the effect. Especially on the Prime Minister of United Kingdom came out a few days ago to give certain incentives to British people, either you are working or not, they're going to pay you. In the US, the same stimulus has just been passed by the Senate, 1.8 trillion.
Former Vice President Atiku Abubakar was saying that 10,000 should be given to every Nigerian, one way or the other.
Well, I don't know the level of, we don't have a data here. That, you know, the greatest problem we have.
Yeah, but maybe if they focus on those who have BVNs, for instance, which records show that about 40 million Nigerians have BVNs.
Yes, Mike. If you limit that, what of my mother in Numungobo in the village?
Because she's a Nigerian
too. My mother is a farmer. My mom is a farmer. Does she have BVN? So it won't get to my village in Numungobo. That's why I'm saying that there should be a mechanism. You understand, for distributing. But that is another challenge for us. It is now high time for us to start building up data. Mike, it is only in Nigeria that you don't know the number of Nigerians. We say, oh, NPC said we are 100. Whenever we say about 200 million Nigerians. We cannot plan based on that. Our budget cannot be predicated on that. That is why it is difficult to plan for infrastructure. difficult to plan for roads, difficult to plan for hospitals, difficult to plan for education, until we'll be able to have a working data that we can use to be able to determine, look at the demography. If you ask the government, our government or agencies, how many Nigerians are between the age of 1 to 35? Nobody can give you that.
Yeah.
In advanced countries, you see that they say, oh, we have the social number of people age between 80 or 60 to 80. You can. Here you don't. So it's a wake-up call for all of us. But let me, at this juncture, also commend the activities of Lagos State government, especially the Lagos State governor, for what he's doing. Just like former Governor Fashola did, he's doing a wonderful job on this, and we can still do more.
Yeah, Lagos is actually leading the others when it comes to, and it is also in a good place for the government to give monies to Lagos to build capacity.
Yes.
To be able to help.
Share the money, they should share for those of us in Lagos, and we know ourselves.
No, the money is meant for to fight coronavirus, not for sharing. Thank you very much, Chris Kendingwandi, for coming on the program. Thank you.
It's time to take a look at stories making the headlines in Nigerian newspapers. I have with me in the studio TVC News senior researcher Cyril Abaku. Good morning, Cyril.
Good morning.
Good to have you here this morning. All right, let's head straight to the papers now, and I begin with the News Direct. Buhari approves 15 billion naira for Lagos, other states, NCDC to fight against coronavirus. Federal government traces 4,370 people. Abakari not secretly flown abroad. Aid. Osun State closes land borders. Others. And on the front page of the Blueprint, as COVID-19 cases rises to 51, well, it's 65 at the moment. Lockdown imminent, federal government declares, says 4,370 cases gave wrong data. Buhari, Hale and Hurty to stop interstate travels. Obaseki, Akeredolu, Diri, lie, others negative. Lawan, TUC seek relief for citizens. On the front page of the Daily Times, NCDC confirms 65 cases of COVID-19 in Nigeria, says 12 new cases confirmed in Lagos, 2 in the Federal Capital Territory. Federal government urges Nigerians to maintain social distancing. Contact tracing of 4,370 persons in progress. Lai Mohammed. Coronavirus may be transmitted sexually, Health Minister. Leadership newspaper now, Nigerian billionaires team up against coronavirus. Dangote, Rabiu Elumelu, via others, donated 1 billion naira each to tackle pandemic. UBA doles out 5 billion naira. G20 offers 5 trillion naira to combat scourge. Federal government bans interstate inter-town movement ahead lockdown. Traces 4,370 contacts with infected persons. To the Daily Trust, COVID-19, federal government still searches for 4,370 contacts, says time running out to check spread. Government acted slowly. Buhari's aide, Bala's friend, test positive. Confirmed cases hit 65. To the Nation newspaper, Nigeria in lockdown. States shut borders as COVID-19 cases rise to 65. And finally, on the front page of the Vanguard, still talking coronavirus, danger as cases rise to 65. More states shut borders. Federal government tracing 4,370 cases. Akwa Ibom, Delta, Kano, Jigawa, Ebonyi, Anambra shut borders. Bauchi records second case. Lagos to discharge 6 patients today. Coronavirus can be sexually transmitted. Health Minister. Presidency fumigates Asirok, Akeredolu, Diri, Obaseki test negative. We are yet to be tested, carries staff will. State House journalists panic. Buhari not coughing, not on ventilator. Lai Mohammed. Cyril, I'd like to start from the point of the federal government saying that we are still tracing over 4,000 persons, about 4,370 cases. And the government said that time is running out. And some have come out to say that perhaps we should observe a total lockdown now. And some are saying a month's lockdown might just be the way to go, looking at the fact that our capacity in terms of health facilities may not be able to tackle this if the case rise.
Well, I think that first things first, we do need a complete lockdown. Maybe not for a month. Perhaps for 2 weeks in the first instance. and this is what it is going to help us achieve. When we impose the kind of lockdown we've seen in Kwara and Kaduna, in the whole of Nigeria, it will force people to say what exactly is happening. I think that will be the kind of the sort of shock therapy that will awaken Nigerians into the reality of what we have on our hands. The WHO DJ has said that, you know, we were running out of time to contain this virus, you know, because the fact is that we don't know if the virus is creeping, whether it is running, whether it is flying.
With the way the rises in cases, it's obvious it is moving really fast.
There are two terms being used, Veronica. One is self-isolation, the other one is stay at home. I don't think Nigerians know the difference between the two, or whether we're even practicing the two distinctly. Self-isolation that is not being monitored, how many homes can effectively take in a returnee and the person is self-isolating? It's not possible because we do not have the facilities to self-isolate. Except somebody will go to a hotel, which is going to look like some kind of quarantine or something. Can they even afford it? So the fact is that we are, in my opinion, we are looking at tracing way more than 4,000, perhaps hundreds of thousands.
Which is concerning.
Okay, look at in Rivers State, for instance. The governor was commending the mother who returned from, who had, you know, traveled to Italy, Greece, and so on, and then she came back. So they're looking at line listing and contact tracing. Who and where she met? Somebody took her in a cab. I don't know, maybe somebody, if so, like if you look at a case and you want to extrapolate, they've come, they've taken cabs, they've joined buses, maybe they've gone to markets to go and shop. So some of the cases that they even say the person didn't contact anybody who came from the UK or from the US or from anywhere. It is only possible that that person might have met a second, third, fourth, fifth, 10th person that an affected person might have contacted. So we're looking at way more than that. I personally don't understand why it will take government this long. I think that at every turn we must be ahead of the curve.
But Lagos State, which is the epicenter of all of this, is saying that it is going to be difficult. We can't afford, rather, to have a lockdown at this point. You understand that a lot of persons, even in Lagos State, depend on daily wages. And you see the state of things, especially at our bus stops and all of it.
It's a good thing that the federal government has given a grant of some billions, some tidy billions to the state government. I think last night, if the information is correct,
yes,
there
10
was
billion.
There was also a statement saying that people should go to food banks and collect food. I don't know.
Yes,
how to, okay, fine. So this is this is the reality. You have to be alive to live. You have to be alive to hustle. You have to be alive. The fact the average Lagosian perhaps didn't think that by now, between February, was it 24th or so, and now, that we'll be converting stadia to isolation centers. I don't think it dawned on us that we're going to get to that point eventually. And so we need to start thinking, from now, where could we? You have to plan for the worst and pray for the best. That's how it's done. So you have to think, if from February to this time we could come to the point where we're now converting stadia to, what could be a worst case scenario in a month's time, and how do we prevent that from happening? So if we say that we're going, I completely agree with. I think there was a statement issued by Barrister Bakoba saying that the president should invoke the Quarantine Act of 1926. You have to do that. Like at least for 2 weeks in the first instance. Lagos State is doing for 1 week in the first instance.
That's for markets.
For markets. You have to do something. In Rivers State, the governor said, and this came as something really revealing and chilling. He said, look, some big companies are lobbying and begging and saying that we should relax the lockdown measures for them to continue to do business. He said, no, the governor didn't have to say that in his speech, but he had to put it there. He said, look, we have resisted because our people's lives are more important than corporate profits. So if at any level of government, whether federal, state, local, if at any level of, we have people, corporate, who are trying to flout this, you know, whose interest for profit or for corporate existence is hindering the fight against the coronavirus pandemic, look, there is nothing, nobody starts to gain anything. You have to be alive to live.
The government is saying that it is implementing drastic measures and being aggressive about it, but then it's not getting as much cooperation from the people, from Nigerians. What do you think is at the heart of this? Is it that people are not well aware or educated about this pandemic, or what is it exactly?
Now, I think it's on two layers. The first is that gradually, in fairness, though, gradually awareness is seeping down. But people are not cooperating on two levels. One is that some people still are still living in the bliss of the ignorance that coronavirus is a foreign disease.
Or the disease for the rich.
Yeah, hold on. Then number two is that those who are saying it's disease for the rich are so happy, in quotes, which is happiness that we shouldn't really share. They're happy that for the first time, there is a leveler. That people who are in high places won't be able to fly abroad anymore. If we're going to die, let us all die together this way. So the support they're not getting should make them think twice and reflect. When we cut down the budget, okay, for this year already because of the oil price and so on. So in next year's budget, we should have provision for pandemic management. And then we should vote money. If people flying abroad didn't make them to realize, whoever should make us realize that we need to vote money to improve the health sector. Going to call health practitioners, and let me say this, who have retired to come back and work. You know, the pandemic makes you to be exposed. Yes. Even for help, you're exposed. People who have already passed 60, 70, you go and call them back to come and face a virus on the front line. It is dangerous. There are pregnant nurses, pregnant doctors among, in the ranks. If you say that people who are doing civil servants from level maybe 1 to 12 should stay home, I think you should exempt people who are also vulnerable, whose immunity is low in the health sector. They should also go home. That's one. Then number 3, Veronica, if we had woken up to the crisis, what I call a crisis, in the mass exodus of our doctors going to Saudi Arabia, going to Canada, going to the US, the people who should help us fight this pandemic are helping other countries to fight it. It's a shame. So I think we need to see beyond, in fact, even
this is a wake-up call.
It's more than, we should sit down and now begin to, what have we done and what should we be doing? You fight coronavirus with what you've built over the decades. Not what is trying to scramble, now to begin to, because, okay, this morning I saw a bus conductor who wore gloves. I told him, Oga, I commend you. I was happy. I said, Oga, I commend you because yesterday, I think the Lagos government had to get leaders of the NTW to go out and try to enforce these things.
All right.
Let us do so much more, but let us lock down first of all. Let's lock down.
All right,
2 weeks.
Cyril, let's leave the discussion here now because of want of time. Thank you so much for your contribution.
Thank you.
Let's head into the papers now, see what the headlines are. I have with me in the studio the CEO of CKN News, Chris K. Ndengwandu. Chris, good morning.
Good morning.
Nice to see you.
Nice to see you,
Great.
Mike.
Let's begin with the News Direct. News Direct this morning says Buhari approves 15 billion naira for Lagos, other states, and NDDC to fight against coronavirus. And federal government traces 4,370 people Abakari not secretly flown abroad. And aid is revealing this on Osun State closes land borders and others. Okay, all that on News Direct. Blueprint is next as COVID-19 cases rises to 51. Now it's 65 anyway. Lockdown imminent, federal government declares. Says that 4,370 cases gave wrong data. All right, Buhari, Hale and Hurty, yeah, and to stop interstate travels, Obaseki, Akeredolu, Diri lie, others negative from the virus. Lawan TUC seek relief for citizens and UBA donates 5 billion naira. UN offers $2 million support. We are ready for uninterrupted fuel supply. Ipman is saying this. Okay, you find all that on the front page of the Blueprint. Daily Times is next. NDDC confirms 65 cases of COVID-19 in Nigeria. Says 12 new cases confirmed in Lagos and 2 in FCT. And federal government urges Nigerians to maintain social distancing and contact tracing of 4,370 persons in progress. As the Minister of Information saying that a coronavirus may be transmitted sexually. Health Minister is giving another dimension to this. All right, Leadership newspaper says Nigerian billionaires team up against coronavirus. And Dangote, Rabiu, Elumelu, Ovia, others donate 1 billion naira each for to fight the epidemic. All right, UBA doles out 5 billion naira, and G20 offers $5 trillion to combat scourge, and federal government bans interstate, intertown movement ahead of lockdown. All that on the leadership. Daily Trust says it's focusing on COVID-19 as well. Federal government still searches for 4,370 contacts. Says time running out to check the spread. Government acted slowly. That's some opinion there. Buhari's aide, Bala's friend, test positive. And confirmed cases hit 65. The Nation newspaper is next. Now, Nigeria in lockdown. States shut borders as COVID-19 cases rise to 65. You find all that on the front page of the Nation newspaper. The Vanguard is next, and coronavirus is still the focus here. Danger as cases rise to 65. More states shut down or shut borders. Federal government tracing 4,370 cases. Akwa Ibom, Delta, Kano, Jigawa, Ebonyi, Anambra shut borders. And Bauchi records second case. Lagos to discharge 6 patients today. And coronavirus can be sexually transmitted. Health Minister is revealing this. And the presidency fumigates Aso Rock. Akeredolu, Diri, Obaseki test negative. Were yet to be tested. Carry staff will. And State House journalists panic. Buhari not coughing, not on ventilator. Lai Mohammed is revealing this. All right. Chris, the news that there is the ongoing effort to trace about 4,370 people. I wonder how challenging this is going to be in the place where we don't have accurate data, even accurate address system, where somebody gives you an address, getting straight to that place becomes kind of challenging. You also recall that the Minister of Minister of Health, when he was addressing the press about 2 weeks ago, was saying that the first people they were trying to contact trace gave information that were not necessarily accurate.
Yes, that's part of the challenges we are going to have. As rightly mentioned, the issue of data is a big challenge to us, not only in this particular instance, but in so many other instances. And that huge number, those that had both direct and indirect contact with those that have been tested so far, and they could be anywhere. They could be in any part of this country. And you know how big Nigeria is.
Exactly.
And mobility is very, very easy in Nigeria. Somebody can be, Mike, you can be in Lagos today. By the time I'm talking
and by
to you,
evening, I'm taking pounded yam in my mother's village. Exactly.
You know, that kind of in the end. So once you move like that, also means that you are also contacting with other people.
Yeah.
Okay, so the trace is going to be very, very, very difficult. What I just feel is that is why we need to, most often than not, try to come to full disclosure on this. Across the globe, there's no big deal in having coronavirus, and it's not a death warrant. It's not the Prince of Wales came out to say that he was positive. The Chancellor of Germany came out to say that she was positive. The wife of the Canada or thereabouts,
Canadian Prime Minister
also came out. So
even celebrities, Idris Elba, and all of the
actors. We just watched the coach of Arsenal coming out to say, yes, okay, I'm not negative.
Mikel Arteta.
I was positive. So, but it's in this part of the world that we continue shooting things in secrecy, and that is what causes problem for us. So by the time you come out to, and I like what Mr. Olakpade did. Yes. You know, what he did, very, very germane, very good.
He tended to have demystified everything by saying, by letting Nigerians know this is not a death sentence.
Not a death sentence.
Exactly.
I have this thing. So what that does too is that those that have been having contact, that have had contact with him within this past,
they'll start checking themselves.
They'll start checking themselves and go for, you understand what they will go for check, and the rest of them. That is the best way. So I think that should be the next phase of our campaign, of our media campaign, to make sure that people should see this not as a death threat or a death warrant, But if for whatever reason you have any contact with anybody,
Yeah.
no person that had this, just go for a test, and that does it.
All right. And another thing Nigerians are reacting to, not necessarily negatively, but they've commended the federal government for releasing funds to Lagos State, to build capacity and all of that. But you know that originally, for 2020 budget, that 15 billion naira was not budgeted. But these are very trying times where monies have to come out somehow. But that money was released for Lagos State to handle the coronavirus, to fight coronavirus, which is beautiful, which Nigerians are commending. But somehow, that money came out of somewhere, and the heavens didn't fall.
Yes.
So Nigerians are saying that if that monies can come out that way, then the federal government can also as well mobilize all the billionaires and all of that to raise funds for any kind of project, critical projects that can save lives in the first place, like the health system.
Yes. On the part of the federal government, the fund probably must have come from an emergency fund bank for issues like this, disaster, sickness, or whatever, or even in terms of war and the rest of them. So that is true. But the aspect of it that, just as it's rightly said, that interests me is the way the most organizations and individuals are coming out as part of their corporate social responsibilities.
Yeah, exactly. To pledge money.
To pledge money and rest of them. Although it is not within them to build hospitals, to build schools and the rest of them, but it's a wake-up call now. What it means is that you cannot just be relying on government all alone. Now is the time for us, the government, to also look to the private sector and be able to galvanize them to be able to put in some of these infrastructures for us. With 1 billion naira that Elumelu UBA gave out to Lagos State yesterday, that can build a hospital, a standard hospital. The same thing we had given to all the states in the federation, same with other individuals. So I think this is it's now for us to put up our thinking cap to realize that at any given point in time, we are going to have challenges like this. This is not going to be the last, Mike, I can assure you.
Yeah.
More will still come. Whether it's coming from China, whether it's coming from Russia, or whatever this thing.
Just a few years ago, we had Ebola. Nobody knew this was going to come now, so anything can happen.
Yes, anything can happen. So I think we should be able to gather. And part of doing that is also, in the course of I know that any fund coming from these organizations as part of their corporate social responsibilities are not tasked. So we should be giving some level of tax incentive to corporate organizations who are ready to give, to be able to encourage them to give. Okay. If you understand what I'm trying to say, that in itself will help. And individuals also, not only, there are some silent billionaires we have that are not the Dangotes, that are not the Lumelus, and there are some people that have this money, even more than the people you know. Yeah. I think we should also be able to come out to encourage them. Some are doing their own things in their own little ways. But I think we should now scale it up to take this probably closer to the people rather than just in the cities.
One other thing that people are commending government for in the fight on the way that Lagos is tackling the coronavirus is opening up isolation centers, or the plan to open up isolation centers in different parts of the state, like in Ikorodu, Ekpe, Badagry, Agege, Ikeja, and all of that. Yes. Now, talk to us basically how that is going to actually help too.
Mike, as on a lighter mood, I should feel that oil is not only what we should be exporting. Now we should be able to, Lagos should be able to export this. Countries of the world should be able to come to Nigeria and Lagos. Learn. Yes, and learn how we are doing this. We did it to Ebola. Yeah. Ebola wasn't from, but if it wasn't for the way we checkmated Ebola, we would have had serious problem. The same thing is happening to coronavirus, especially in Lagos, the way the government is going about it. Other African countries and even foreign countries should be able to come to and find out how we're able to do that. And I commend the Lagos State government again for opening up. So let me give you a good instance. If somebody has coronavirus in Bauchi, for instance, or probably you have one center, or some people have, the person may have to travel all the way to Bauchi to either Abuja or come to Lagos. And in trying to do that, you know what happens?
Exactly. You come in contact with people.
That is the problem. There are so many states in the federation now that I know that might not have the capacity to be able to handle that. So what we should do now is trying to set up as many centers as possible so that people can find it easy to be able to go. Somebody in far away in Badagry doesn't have to come to Ikeja or to Island to be able to do that, which is what Lagos State is doing now. I commend them for that.
We have to leave you here now. Thank you very much, Chris Kendengwandu, for coming on the program.
Thank you very much, and stay safe.
Thank you. Yeah, exactly. We all have to stay safe.
We have to.
All right, you're watching TVC Breakfast.